1 in 2 men in their lifetime will be diagnosed with invasive cancer, and for women it's a little bit better, it's 1 in 3. My name is Dr. Mark Levandovsky. I'm a preventative oncologist, hematologist, and internist. I have a practice in Denver, Colorado, called Preventive Medicine and Cancer Care, and I focus a lot on up-to-date, as in 2020, appropriate cancer screening and detection, and prevention as well. We focus on cancers that are most prevalent as well as the most lethal. So the most common cancers would be breast cancer for women, and the recommendation currently is to get a mammogram sometimes between 40 and 50, and 2-dimensional mammograms, which is the standard, is really inadequate for breast cancer detection. At the very least, a woman should get a 3-dimensional mammogram, but if a woman has more than 2 family members with breast cancer or ovarian cancer in her family, has dense breasts, there should be really strong consideration given to doing the breast MRI instead. It is much more specific and much more sensitive in picking up small breast cancers that mammograms can easily miss. The equivalent of breast cancer for men would be prostate cancer, and we know that some of the most common ways to detect early prostate cancer is to use what's called PSA, prostate-specific antigen. That's usually a blood test, and we know that it is also a very inadequate test, and upwards of 40% of prostate cancer could be missed with it. So usually for folks who have a PSA greater than 2, strong consideration should be given to what's called a urine biopsy. It's a test that you can use to basically pee in a cup, and in that urine, you will be excreting snippets of cancer, tumor cells, and DNA. And we can pick that up with very high accuracy. And used as an adjunct could really help with early detection. Switching gears to the most lethal cancer that we have in the US, which is lung cancer, one should really pursue annual CAT scans if there is history of smoking and environmental exposures. That's been shown to significantly reduce death from lung cancer, and we need to utilize that resource. Next one to address is colorectal cancer. The standard of care for colorectal cancer has been do a colonoscopy from age 50 every 10 years and shake your gastroenterologist's hand. And what we know is that the rates of colorectal cancer has been hugely increasing, upwards 20% increase, especially in the younger population, 40 to 50. So at the very minimum, one should start doing a colonoscopy now at age 45. And depending on and if there are any polyps or strong family history of colorectal cancer, the frequency of colonoscopy really needs to be reevaluated from every 10 years to maybe every 3 to 5 years, depending on those findings. Switching gears to more of lifestyle and nutritional recommendations, we know that what we eat and how we relate and how we exercise matters a lot. So whole plant-based diet is tremendous in reducing the risk of cancers, upwards of 50% in different studies. Maintaining a vitamin D level between 50 and 80 has also been associated with reducing cancer by as much as 20%. So 2,000 units of vitamin D3 daily is a very meaningful supplement. A handful of tree nuts has been shown to reduce colorectal cancer rates as well as upper gastrointestinal cancer rates such as pancreatic cancer by as much as 40%. So raw tree nuts daily is a wonderful thing and super cheap. Multiple studies have shown that regular aerobic and core exercise, so 40 minutes of brisk walking a day, can cut the risk of cancer by 40% as well. So being active, and it doesn't mean that you have to run marathons. And what's also very important to consider is these new tests that we have available, and I probably will close with that. We're entering an age of precision medicine where we can really tailor someone's risk and start finding these really small snippets of cancer cells, cancer DNA floating in the urine, floating in the blood, floating in the saliva, floating in the stool. And we have tools now to check all of those things, saliva, stool, blood, urine, to see if we can detect that. So people who are at higher risk should really pursue these novel technologies to be able to mitigate the cancer risk. One more thing that I should mention, because it's just so commonplace that sometimes we forget, that things that we don't have to go into the stars to get a huge benefit. Drinking more than 5 alcoholic drinks a week can nearly double the chances of cancer from here to there. So I would really encourage people to stay under 4 a week to mitigate that risk. And fiber is super important, and I'm not talking about fiber that you can get from vitamins, but actually fiber from whole plants and veggies. So 30 grams of fiber consumed from whole plants and vegetables decreases the risk of colorectal cancer and upper GI cancers by and large by nearly 30%. If you take 30 grams of fiber in a supplement form, it does pretty much 0 for you as far as cancer risk reduction. So please remember that you are what you drink, eat and drink. Thanks very much.